express my feelings about my healthcare and all the questions and concerns that I may have.
Hi Jim, my name is Mel and I was the paramedic myself who took care of you after your accident. I understand that you may still be in shock due to the series of events that has occurred during the past 24 hours. You rated your pain 10 out of 10 at the time of incident, so I needed a CCP to come and administer a stronger painkiller such as morphine to reduce your pain. So I'm here to walk you through what my crews and I did for both you and your family, and as well as to answer any questions that you might have in relation to your healthcare. So you're now being kept at the Charleville local hospital before being transported to Brisbane.
Why do I need to be transported to Brisbane? Why can't I be treated here?
The reason you're not being treated here in Townsville is because you require a major trauma centre because you suffered from multiple fractures and a penetrating injury to your lower limb. Due to the mechanism of your injury, we also suspected a C-spine injury, which also requires you to be treated at a major trauma centre.
Okay. Where is my family? Are they okay, or can I see them?
Yep, so other members of your family are also being transported to Brisbane, but I'm unaware as to which hospital they're staying at.
Okay.
However, once we reach Brisbane, I will be able to speak with one of the nurses, and then they can be able to follow up on your family's whereabouts.
Okay. Thank you.
Hi Jim, my name's Courtney and I'm your medical manager.
Hi, I understand you've already taken scans of me. What will these scans do and what will they mean for my treatment?
Yeah, so I've taken an image of the side view of your head and neck just to ensure there's no neck or spinal fractures. As a precautionary, I also took a head and neck CT, as sometimes fractures don't show in x-rays. The head was also to ensure that you didn't have any internal bleeding into your brain. And the chest x-ray, there wasn't any damage to your chest cavity, and the pelvic was to ensure there wasn't any pelvic fractures. When you're in a more stable condition and require some x-rays of both your legs, just to check out the extent of the suspected fractures to your fibulas, tibias, knees and femurs. These images will help classify the type of potential fractures you have to help inform your post-operative and rehabilitation care teams, such as your podiatry and nursing teams.
Will x-rays have any risks to my health?
So most of the effects are extremely short term and the chance of effects is extremely low due to the small amounts of radiation given. I do have to precaution you of slight short term reddening of your skin, however this is extremely unlikely.
Hi Mr. Lovegrove, I'm your nurse Beck and I'll be here assisting you throughout your hospital journey. So this will just include things such as taking general observations to track the progress of your overall health, chatting with you, your podiatrist, pharmacist and radiation therapist to organise appointments, ensuring your needs and expectations are met, and being your primary point of contact for any queries you have for your hospital journey and the associated costs. So as your nurse, I'm here to learn about you, what you expect from me, and ensuring that you understand your treatment so that you're well informed of your treatment choices. Do you have any questions?
With my level of cover, I'm concerned that I will be a financial burden on my family. I was just wondering what level of cover is available to me.
Yep, so from Mel's handover in your patient notes, I can see that you don't have private health insurance. This is nothing to be concerned about because the Royal Brisbane Hospital is part of the public system, so the majority of your finances will be subsidised by the Australian government under Medicare. I can also put you in contact with our Indigenous Patient Journey Service, and they'll work with you, myself, and your healthcare team to support you throughout your hospital journey.
Okay, thank you.
Hi Jim, I'm your pharmacist. I'll be monitoring your medications and how you're reacting to them to make sure they're working correctly, efficiently and specific to your individual needs.
I just have concerns that the medication might affect my diabetes medication.
I've checked for contraindications and drug interactions and consulted with your doctors to make sure that there'll be no potential problems. I've also been working with your nurse who can monitor the side effects, and if there are any we can reevaluate. I've also been liaising with your podiatrist regarding the most appropriate dressings for your wounds. However, if you have any more concerns or questions regarding your medications or any side effects, don't hesitate to consult with me to ensure minimal risk of readmission or medication discrepancies upon your discharge from hospital. I'll also follow up with you shortly after your discharge to make sure all the medications are still appropriate, paying particular attention to your pain management and analgesia.
Thank you.
My name is Beck, and as your podiatrist, I assist in treating and rehabilitating conditions associated with your lower limb and feet. Post-surgery, you're at risk of developing deep vein thrombosis, or DVT, and I assist the team in monitoring any signs of DVT, including swelling or any pain you might have in flexion of your feet. Your pharmacist has also informed me that you're currently on heparin as a preventative measure for DVT, and this affects how we treat your ulcer, as the use of a scalpel can increase the risk of hemorrhaging. Because of this, I've been in collaboration with the wound care nurse so that we can debride the damaged tissue with appropriate dressings such as hydrogels.
I was just wondering how we're going to manage the wound in my leg.
Yep, so after you discharge, we can focus on rehabilitation of the ulcer. So ulcers are chronic wounds that do not heal within the required time frame. So patients such as yourself with type 1 diabetes mellitus are at increased risk of ulceration due to peripheral neuropathy and poor vascularization of the lower limb. And so involving yourself in this process is extremely important to your healthcare, as well as it is for me to engage in an interdisciplinary team in developing your rehabilitation plan. And doing this can reduce your 2-year incidence rate. And after healing, it is important that you continue to liaise with your GP, as well as myself and the healthcare team, because you're now at increased risk of ulceration due to this previous injury.
Okay.
So this is vital for your future mobility to abate any risk of amputation so your life can return to as normal.
Okay, thank you. Originally, I was concerned with the number of healthcare professionals tending to my case that my opinion would be lost along the way. However, I was encouraged to be involved in my own care, and I was assured that this will increase my own satisfaction throughout my hospital stay, decrease my length of hospital stay, reduce the chance of readmission, and also potentially reduce my hospital healthcare costs as well. It surprised me to know that Aboriginal and Torres Strait Islanders receive less procedures and prescriptions than non-Indigenous Australians, despite having the same conditions. However, these professionals have assured me that they strive to provide a culturally respectful and non-discriminatory health system. I'm grateful that it has been acknowledged that my situation has been difficult, and it can put plenty of mental strain on me as well as my physical recovery. After all, my health is inclusive of my physical health as well as my mental health. Also, I have been assured that my healthcare professionals that are involved in my case will communicate clearly, as good communication forms the foundation for effective care.